Hi, my name is Trinity Johnson, and today I'm going to perform my NG2 placement checkoff. Here's my ID, and let's get in my room. Awesome, here we go. Here we go, sorry. There we go. So first what we're going to do is we're just going to verify hospital policy and our order. So we've done that. Now we're going to do two identifiers. So in our order form, we have Jaguar J. Jones and our number 4176352. And on our patient's wristband, we have Jaguar J. Jones and our number 4176352. So next we're going to check for allergies, and we see that Mrs. Jones has an allergy to penicillin on the order form, and on her wristband we see that she has an allergy to penicillin. Now I would also ask, hey Mrs. Jones, are there any other allergies that aren't noted? Awesome. So next what we're going to do is we're going to explain the procedure to Mrs. Jones. Hey Mrs. Jones, today you're going to be getting an NG2 placement. Any questions? Awesome. Next I'm going to provide Mrs. Jones with some privacy, and I'm going to perform hand hygiene. So now that I've done that, I'm going to gather my equipment and don my goggles. So once I've donned my goggles, I'm also going to make sure that my stethoscope and pen light are ready to use, readily available. Awesome. Next I will raise my bed to a working height and lower my side rails. And I'm going to also assess my patient's vital signs, oxygen saturation, and bowel sounds. And if my patient's oxygen saturation levels decrease or the vital signs begin to deteriorate, we're going to stop we're just going to halt the procedure, and just until the patient's stability can be assessed. Awesome. So after that, we're going to put the bed into a high Fowler's position, and we're also going to establish a queuing sign with our patient if the patient if the procedure just needs to stop. So we're going to assign a queuing sign. Yes. After we assign that, we're going to open our tubing, and we would place a dollop of water-soluble lubricant on the inside of the packaging. Next, we're going to loosen our 60 milliliter syringe, and next we're going to don a pair of clean gloves. All right, so what we're about to do is we're going to check for patency in our patient's nose, and we're going to do that alternately. So we're just going to have the patient breathe normally, and we're going to alternate from the right to the left there, checking for patency. So once we've checked patency, we are going to, we would usually measure our patients for tubing. So when we do that, I don't have a person to do that for right now. So we would start from the tip of the nose to the earlobe to the xiphoid process, and we mark that with dog tape, and we would not do that over our patient's clothing. I'm just gonna swipe back really quick because it moved on my computer and I need to see myself. Thank you. So after we've done that, we are going to place a towel over our patient's chest and a large basin on the abdomen. So next what we are going to do is we are going to, I'm gonna go ahead and pick up my tubing so this makes sense to me, and we are going to lubricate. So we would lubricate the first 4 inches. Awesome. So next we're going to instruct Mrs. Jones to tilt her head back towards her pillow. Hey Mrs. Jones, can I get you to tilt your head back for me? And I'm going to start inserting. Okay. So we're inserting, and let's say we've already gone beyond the nasopharynx. So once we've done that, we're going to get the patient to relax and slightly bend their head forward. So once we get the patient to do that, we're checking for any signs of respiratory distress, like if the patient's coughing or if our oxygen saturation levels begin to decrease. Then we're gonna have our patient to, we're gonna retreat back to the posterior nasopharynx, and we're gonna get the patient to try to breathe normal again, and we're gonna get the patient to, dry swallow or take some sips of water before we try to advance again. So after we've got our tubing in there, we are going to connect it on the cheek. I'm going to connect mine on the cheek, but you could also do it on the nose as well. Don't let go of your tubing. This is very difficult. I'm so sorry. This is not how you do it, but there we go. Okay, so now that you would have it secured on the cheek like that, you wouldn't let go like I did. I apologize. But you've got that secured, and we're just gonna check in through the mouth with our pen light, and we'd have a little tongue compressor. I don't have one, but you would be checking, make sure the tubing was all good in there. So next, what we are going to do is we are going to connect our syringe. So that is going to go through this port right here. So the purpose for this is we are making sure that we are in the correct place. This is where we are aspirating for gastric contents. You could also have an order for pH levels to assess that, or you could also have an order for an X-ray. So once we've done that and we've got all our I'm so sorry. We've done that. We are going to I'm gonna go ahead and just take this off now, I'm guessing. And I would clip it to my patient's gown if I were to do that. So next we're gonna take a skin prep pad and we're gonna prep the nose, and we're gonna remove this cheek tape, and we're gonna use I call it the fancy tape because of the way we had to cut it. So I'm gonna take this and put it on the bridge of the nose, and then have it, it's supposed to be floating. So that's as floating as I can get, as you can see. Okay, so once we've done that, you can mark the exit site with an indwelling marker. So now I'm gonna just instruct on how you would connect it to suctioning. If suctioning has been ordered, you would take this, the suctioning is obviously connected to the wall, you would connect and have it at low wall intermittent suctioning. Yes. So after that, if there's not, you can just take this, and with this blue pigtail, you could just cap it like this. And then you're gonna have it above stomach level. So after that, we're going to elevate the head of the bed to about 30 degrees. We're gonna do that. And then we would make sure our patient is comfortable, lower the bed, raise the side rails, remove the towel from our patient, make sure everything is all right. They've got everything they need in reach. Awesome. And I'm going to remove my gloves and dispose. Awesome. So next what we're going to do is document. So what we're documenting is the size and type of NG tube we used, the location, meaning like which nair, the right or the left. We're going to note if suction was ordered, how we secured it, how we made sure we were in correct placement. We're also going to document how the patient tolerated our procedure, and we are going to document any color, amount, characteristics of secretions. So awesome. Next, we're going to do how to discontinue our NG tube. So when we're discontinuing our NG tube, we are going to make sure we check that order, make sure we are discontinuing this tube. Then I'm going to apply another pair of clean gloves, and I would also auscultate. I will quickly demonstrate that if it is needed. So we are going to auscultate our patient for vowel sounds, and then we are going to turn off suctioning. So once we do all that, we can remove our tape. So let's do this as carefully as possible because I do not want this to fall on the video. Oh, it's gonna fall. So to remove the tape, it has gotten really sticky. So we have removed our tape. Now what we're gonna do is we will unclip it from the gown and we're gonna kink it on itself, kink the tubing on itself. And once we've done that, we are going to ask the patient to take a deep breath and hold it, and then we're going to pull it out slowly, smoothly, gently. Do not want to hurt our patient. So once we've got that pulled out, we are going to measure drainage, perform oral care, and we will document for discontinuing it. That is my NG tube check off. Thank you so much.